Hi, I'm Dr. Durga Prasad from Ankura Hospital, Banjara Hills. I'm the Senior Consultant Pediatrician here. Today, I'd like to talk about frequently asked questions from the parents who have a first child. The most common questions asked by the mother is the feeding part. Feeding part is the major thing where the mother needs to be counseled a lot, because the first time mother will have lots of questions regarding the breastfeeding. The first thing is, the first question every time I get a patient who is newborn baby is, the mother asks whether my breastfeed is sufficient or not. There are few points where we can say indirectly, because indirectly we have to see whether the breastfeed is sufficient or not, because directly we can't see how much amount of milk the baby is taking from the breast. So there are few points where the mother has to keep in view. First thing is, feed the baby every 2 hours for 15 to 20 minutes on one side, and the next feed would be after 2 hours on the other side. So by feeding the child every 2 hours for 15 to 20 minutes, and the child is passing around 6 to 8 times of urine in whole 24 hours, says that the baby is getting enough amount of milk, and the mother is producing enough amount of milk for the baby. Second point is weight gain, which the mother will not monitor regularly, but initially for first 3 months, the baby would be gaining around 30 grams a day. And after that, it would be around 15 to 20 grams a day. So the second is weight gain. And next is the motion. If the baby passes around 2 to 3 times of motion in a day, shows that the baby is getting enough amount of milk. So motion is another point where sometimes the baby may not pass motion 2 to 3 times, but urine output is a major point where whether the mother's feed is sufficient or not. This is from the baby side. From the mother side, if the mother starts feeding the baby on one breast and the other breast starts dribbling by itself, it may be once in a day or twice in a day. It may not be every time. If this point happens, then we can say the baby is getting enough amount of milk. So another point is, most of the mothers, what they do is they feed the baby on both the breasts every time. That is not good for the baby, because breast milk has two things where there is called as foremilk and hindmilk. The foremilk is the milk which comes first, which is high in water and sugars. The hindmilk, which comes later on, will be high in protein and fat. The protein and fat which would be helpful in the baby for gaining weight is in the hind milk. So once you start the baby feeding 5 minutes here and 5 minutes here, the baby is not going to get the amount of nutrition what the baby has to get. So what we prefer to do is empty one breast totally on one feed, and the next feed should be on the other breast. This will make the baby get all the nutrients and properly allow the baby to gain weight. Second point is keeping the baby warm. Weight gain is a major thing which we see for the first 3 months for a baby. So keeping the baby warm makes the baby comfortable and helps in weight gain. How this is related? See, once you start feeding the baby and don't cover the baby properly and don't keep the baby warm, what happens is the amount of calories the baby takes in would be going in for the baby to keep herself or himself warm. So once we do the warmth care and keep the baby warm always, the baby would be warm, and whatever calories the baby has taken in the breast milk, in the form of breast milk, would be utilized in the weight gain properly.